So, what a day today was. I had my appointment with the hematologist this morning, and I obviously met with her. I met with another doctor who I believe was the oncologist, and I was meant to meet with another doctor today, but they weren't there. Anyway, we when I went in, we spoke a lot about like the journey of how we got here and what the symptoms have been so far, and we went in depth into everything that could possibly be related to the lymphoma. So we discussed a lot of things like night sweats and hot flushes and itching and what else? Weight loss, which unfortunately I didn't have or don't have. I don't know, lots of other stuff. I'm a little bit foggy. There was just so many words spoken to me today that it was just like an overload of information. But after we spoke about all of the symptoms, we then, she then performed like a little physical exam where she tried to feel for any lymph nodes in my neck, lymph nodes in my underarm area, and as well as in the groin, but she couldn't feel anything, which didn't surprise me because from all my other scans and things, they're quite deep. She also checked my lungs, did my oxygen levels, did my blood pressure, which for some reason the machine wasn't working today. How unusual. And then after that, we then sat down and had a bit of a chat of treatment. So they're still not 100% sure with the stage or the subtype, but she's thinking that it can either go two ways at the moment. So you've got the first regime, which is the ABVD drug concoction, or it's a Picc drugs, and then with that, she mentioned it could either be 4 cycles of chemo plus radiation, or it could be 6 to 8 cycles without the radiation, and then 1 cycle is 2 treatments per month. So if I end up having 8 cycles of chemo, then I'd be having about 8 months of chemo. So that was a little bit like, I don't know, not a punch in the gut, but like just, it was quite like a bit of a shock, because after, like, with all my research and stuff, I was reading that generally this takes maybe 3 or 4 cycles. But and then we were talking about where the lymph nodes are affected in my body, and I said, like, because they're only in my chest and my neck, is there any chance of it being in my bone marrow? And she said it's unlikely, but like there's still a chance. And then she also said that on the PET scan, that there's a bit of activity in my spleen and in my lungs. So tomorrow they're having an appointment to discuss any more tests or scans or anything that they need to do with me, and whether I'll need a bone marrow biopsy. And then on the Friday, hopefully they will have a treatment plan in place. So that's that side of things. We also had a brief chat about fertility, but then she directed me on to talk to somebody else. But so after I had my chat with her, I ended up going to get a blood test done, and whilst I was waiting, there was a lovely lady, I don't know what her name was, but the whole reason that we started talking was because she sneezed, and I said bless you, and then I sneezed and she said bless you, and then the reception lady came over and was like, There is a bit of a wait. There's some people in there at the moment who are getting some treatment, which could take a while. We've got the other Path West collection centre, like down the other end of the hospital, if you'd like to go. And I was like, yeah, okay, that's fine. So I said to this lady, I was like, are you coming? And she's like, oh, how far is it? Like, I've got a sore back. And I was like, oh, I'll just wheel you in the wheelchair. And she was like, are you sure? I was like, yeah, I'm going down there anyway. Like, I'll just wheel you. And she's like, oh, go on then. Like, what the heck? And then we went to look at the wheelchairs and I was like, what colour do you want? Because there was like orange and purple and a black colour. And she was like, oh, I'll just walk. And then as we were walking to the elevator to go upstairs, she was like, you're too young to be here. And I was like, yeah. She goes, if you don't mind me asking, how old are you? And I'm like, I'm 26. And she goes, oh, it's so young. And then we got into a bit more conversation. And then she's like, she asked me a question. I can't remember what it was, but she was like, sorry if I'm getting too personal. I was like, oh, no, I'm an open book now. And I ended up telling her that I've got Hodgkin lymphoma. And she's like, oh, I had non-Hodgkin's. I'm 12 years in remission. And but the further we got into conversation, she ended up saying that the whole reason she's there at the moment is because her recent blood test showed a higher level of white blood cells, which could be an indication of the lymphoma coming back. But fingers crossed it wasn't, because she was very lovely and very sweet. But we ended up saying our goodbyes, and I said to her, like, if I see, hopefully I don't see you in the treatment rooms, but if I do, I'll come say hi, and you know, you should come say hi to me and whatever. And then after my blood test, I ended up going back to the adolescent youth cancer centre. Oh, what is it called? Something to do with adolescent health and cancer. And when I went in, I was like, I just kind of felt like I'm too old for this. But so generally they take in patients that are aged between 18 and 25, and I'm like, I'm 26. And they go, sometimes we also have patients that are like 26, 27. It just depends on like how busy they are and how many people they have like on board at that time. But in this place, it's almost like a common room that's equipped for just people, like young people like myself, to just chill out. So there's like a nice lounge you can sit on. There's a big telly with a PlayStation you can play on. There's a big bookshelf of books. There's a computer you can use. There's a bench that's currently set up with a puzzle that you can do. There's a dining table. There's a microwave. You can microwave your lunch or whatever. There's fridge you can store stuff in. Make yourself teas and coffees. Like, they just said it's a place you can come and like chill out. I thought that was quite cool. And then spoke with one of the ladies, and a lot of the conversation with her was about fertility. So with the chemotherapy, there is chance that it can affect your fertility. And with the different ones, with the ABVD and the BIACOP, one of the ABVD is not as intense, so the chances of having fertility problems in the future are a lot less than the BIACOP, because that one is a bit more intense. But we spoke about like egg retrieval and stuff, which the whole process of that could take between 6 and 7 weeks. So in those weeks, you're having injections and I don't know, all sorts of other stuff, where in the end you finally go in for an egg retrieval procedure and whatever. And then the eggs obviously get stored. And I asked her, like, how much do you know how much this would be? And she said the cheapest place I know is $4,000, and that's just for the 6 to 7 week process. So all the medication you need as well as the egg retrieval. But then it's also $680 per year for the centre to store the eggs. And then on top of that, in the future, if I do want to like use the eggs for pregnancy, then I would also have to pay for the treatment of the IBS. IVF, sorry. And then the other price range she knows is about $10,000, but then that includes all of it. So the medication, the process, the retrieval, the storage, and I'm assuming the IVF, I don't know, she didn't really mention that. But yeah, so that whole thing would take between 6 to 7 weeks. And then she said the other thing that is quite common is there's an injection that you can get, I can't remember the name of it, but an injection you can have each month, which basically puts your ovaries and reproductive system into like a temporary menopausal state. So within that, I don't know, it just stops, but then you get, you know, hot flushes, and you can get like headaches and a lot of other stuff, she said. And I was like, lovely helicopter. All these other things. And I asked about the success rate, and she said it's still fairly new, but we have had patients that have, you know, gone through chemo and they've had that injection and they've gone on to have children. So I think at the moment I'm happy with just doing that injection. Also, another thing was if I didn't have children, then I wouldn't have had to pay for any of like the egg retrieval process, but because I've already got a child, I have to pay for it. But yeah, so anyway, I think I'll be going with the injection. It's a bit crazy thinking I have to kind of think about fertility and if I'm going to be able to have children in the future. Like, I'm pretty adamant at the moment that I don't want any more children and Hazel's enough. But, you know, what happens in the future if I want to meet someone? I don't know. So it was just quite, I don't know. I want to say mind-blowing, but not mind-blowing. Just having to think and talk about that. And then I ended up speaking, oh no, sorry, so still with this lady. She was telling me about all the different like support things they offer, and we were talking about like hair loss, for example. And she said that with the chemotherapy that they want to do for me, the chances of my hair falling out is like pretty predictable. Like, the hair is gonna fall out. And then I was talking about, like, I've already been researching and looking up for like beanies and scarves and wigs and things. And she said that they actually give out $160 vouchers to their patients that they can use towards buying a wig, which I thought was quite cool. And then she also said, I can't remember what date, but maybe the 29th of September, they've got Live Good, Feel Better or something, where a guest speaker comes out and all of the youth cancer patients meet up in this common room, and we all listen to this person talk about it. And she talks about like how you can style scarves and how you can fill in your eyebrows when they're falling out, and there's like a goodie bag you can get with like makeup and stuff in it. So that sounds like quite fun to go and do. And then I ended up seeing this other guy who, this first girl, she's like the hospital life youth worker, if that makes sense. And then the other guy that I saw, he is for like life outside of the hospital. So we spoke a lot about uni today and deferring that and stuff. And what I thought was quite nice is if I wasn't comfortable with speaking to uni about deferring and stuff, part of his role is for him to contact the university and discuss everything, which I thought that's quite nice. But I'm happy to go into uni, so I plan on going in tomorrow. And then we spoke about a whole bunch of other stuff outside of work. And then within this youth centre, there's also another lady who takes care of the physical side of like the chemo and stuff. So there's a gym that once a week she does a one-on-one session with the patient, with a patient, so with me, to make sure that like strength and fitness and stuff is like kept up to, I don't know, kept maintained. So I think that's about it for now. Feelings wise, it was a bit kind of hit me today that like I'm a cancer patient. I have cancer. Like going into the clinic to go and see my doctor, like looking around and there's like people with their bald heads, and you can see people with scarves covering their bald heads and their beanies, and waiting for like my blood test, and I saw a guy with like a tube in his nose, and it was just a bit of like a shock to the system. I feel like I've been handling everything quite well, but today it hit a bit different. I felt for the last few days like I've had this feeling of like fraud, in a sense of like lymphoma is so treatable and curable that like why is it associated with cancer, or why is it called a cancer? But then like the more I thought about it today sitting in the cancer center, was like it is a cancer. It's like a cancer of the blood, and the only reason it is treatable and has a curable outcome is because of all the research and the like studying that has gone towards it. So I don't know, it's just crazy. I don't know, crazy. Cancer, me. I'm associating cancer with me. I have cancer. So yeah, I think that's about it for the moment. And when I know more, I can share. So I'm gonna go to bed now because it's now 10:20 and I'm feeling a bit tired. So good night, and I will see you whenever. Bye. Hello, little update. So I received a phone call a couple of days ago confirming the chemo regimen. So at the moment the plan is to do 2 cycles of chemo, which is equivalent to 2 months of chemo and 4 treatments, and then to do a PET scan to see if the chemo is working. If the chemo is working and showing progression, it'll be another 2 months of chemo, so 4 treatments, followed by radiation. I'm not sure how much radiation there will be. And then if at the PET scan the chemo is not working, there'll be a few changes in terms of changing drugs or changing the whole different course. So the chemo that I'll be having is called ABVD, which is a very common, or it is one of the most used regimens for Hodgkin lymphoma. So ABVD stands for the 4 drugs that are in there. You've got adriamycin, bleomycin, vinblastine, and dacarbazine. So they will be the drugs that I'll be on for the next few months. And before I start chemo as well, I'm going in tomorrow. I have to be at the hospital at 8:30 as I'm having a pulmonary lung function test. So I'm not quite sure how this test is going to go, but basically it'll provide the oncology team with a baseline of obviously my lung function, so that they can see if there are any effects due to the chemo. So one of the drugs, I believe it's the bleomycin, can cause damage to your lungs. So if there's any sign of damage in the PET scan after the first 2 months, they'll take that drug out, and there might be a new drug incorporated, or they might change things. I'm not too sure yet, still very unsure of a lot of things. So yeah, that's the test tomorrow. And then I also got a phone call today from one of the youth support workers at the cancer service, and she was saying, basically confirmed that my chemo will start next week, so on the 9th of September. So I'll be having chemo on the 9th of the 9th at 9 a.m, which is 79s. And then the lady that phoned, she's also the health and fitness youth worker. So tomorrow I'll also be meeting her at 10 a.m to discuss like treatment and how it's going to affect me in terms of fatigue and tiredness and energy and all of that jazz. I think that's it in terms of what's happening in the hospital so far. Yep. Another thing that I've been thinking of is September is Lymphoma Awareness Month. So Australia goes Lyme for lymphoma. So basically each cancer has their own kind of coloured ribbon. So the one for lymphoma is lime green. So to support the cause and to bring awareness to lymphoma, I will be dyeing my hair green. So I was at the hairdresser's today, and basically I want my roots to stay a dark colour, and then basically the rest of my hair, they need to dye it blonde before it can go green, obviously. And when I showed her a picture of like the blonde that I want, she said that this could take up to a year to get to that point, and I was like, okay, well, you know, I want to dye my hair green to support lymphoma, blah blah blah. And she was like, okay, and she said like, still, like, we probably won't be able to do that in one session. And I was like, okay. And then I basically told her that I'm starting chemo next week and I'm gonna lose my hair anyway. And she was like, oh, okay. And then she brought another hairstylist over, and this hairstylist was saying that we could potentially like get my hair a light enough colour so it's like a yellow colour, and then they could put some blue over the top to make it the green colour. And then the first stylist interrupted and said she's having chemo next week, so we'll be losing her hair. And the other stylist was like, wow, okay. So that kind of changed everything. And basically they said that they can do a lot of lightening treatments in one day to get my hair as light as they possibly can. So obviously they said to me, like, obviously our main priority is to make sure that your hair is healthy and strong, but if you're going to lose it and you're happy with this, we can basically bleach the shit out of it. And I was like, yep, that sounds like a plan. So I'll be going in on Wednesday at 9:30 they said it could take up to 6 hours to basically get the end result. Whilst I was in there talking to them, I started crying, which was different because I haven't cried about any of this yet. And I was at the shopping centre I ended up meeting my older sister and 2 of my nieces, and when I bumped into them, I just basically had a meltdown in the middle of the shopping centre. So it's interesting that talking about my hair and like dyeing it green and then it like falling out and stuff, it kind of hit me a little bit, so I was a bit emotional all day today. I'm feeling okay now, but I feel like if I start crying, I'm not going to be able to stop. So it's all, I think, becoming a little bit more real. So I don't know how I'm going to be, I don't know, next week or the week after. We're just going to have to wait and see. But that's it for now, and I'll see you later. On my way to my lung function test after a very hectic morning of lots and lots of traffic. Oh my goodness. Gave myself an hour and a half to get here. It took me an hour to get here. Hey. In the waiting room for my pulmonary lung function test. So when I got home today from the hospital, my older sister was in the kitchen. She just got us some food. So I got my food and got ready, and I turned around and there were some flowers on the table. I was like, oh, whose are those for? What are they? And then I looked at it and I saw on the card from a friend who brought me flowers. And then I started crying. I was like, I was having a good day. So thank you. Thank you. But thank you for making me cry. They're lovely. So I went and had my pulmonary lung function test today. And when I went in, we just spoke about like my shortness of breath and anything else that made it like worse or better. We spoke about some of the history of what I've had done at the hospital. So about the bronchoscopy and the mediastinoscopy, as well as like my chemo plan. And then it basically got into the test. So I had to wear a peg on my nose, and in front of me was this machine that I had to put my mouth on the mouthpiece, and I basically had to breathe into it. So some of them you had to breathe in slowly, breathe out slowly, or breathe in quickly, breathe out quickly, and it was kind of like a various combination of those things. And then after that we had to do some other different tests. So this one was I had to sit in like this, like a chamber and the same breathing instrument thing machine that I used, it was like swiveled around so that I could use it in the chamber. The lovely man took a photo of me sitting in it because I asked if I could take a photo of it. He said, oh, I can take a photo of you in it if you like. So I'll insert that somewhere there. Yeah, anyway, so that one was a bit weird in terms of being inside it with the door completely sealed off, and it was quite like small. And when he spoke, I could hear it as like a speaker in the chamber, and it just felt like a little bit claustrophobic. So the breathing that I had to do in the chamber was pretty similar to the first one, except there was just one that was different, where basically the machine, you can turn like the oxygen supply off, and you almost like hyperventilate into the thing. So, and basically that bit was like measuring like how you can reuse the air, so recycling the air. All throughout these little breathing tests, some of them, like with the breathing, I ended up getting like a pain in my head, which I've had this sharp pain in the right side of my head for a little while. It was worse last night. Like I did a big cough and I felt like something exploded in my brain. It was very strange. But anyway, and then today as well with like the breathing, and then at one point I had to hold my breath for like 8 seconds, and I think I almost passed out like 4 times. Like everything went black and it just like it went funny. Other than that, it was okay, I suppose. And anyway, after like the chamber test, the next part was he gave me some Ventolin, and then we repeated the first part of the test just to see if there was any differences in between the no Ventolin and the Ventolin, which there weren't any differences, which is not surprising. But I coughed like a lot through it, and obviously lost my breath a few times, but that was that. The guy was really lovely. We did a lot of chatting about like like studying and things that he's interested in. He was a lovely man. I can't remember what his name was, but he was a lovely man. And then anyway, from there, I ended up going to see the fitness youth worker. We spoke about the chemo and how it would affect like my everyday kind of energy levels. Generally like major fatigue and stuff. She was saying that in the middle of your cycle, so one cycle is 2 treatments, so in between the treatments there's a couple of days where you're very low and you can be neutropenic, I think was the word, which can affect like your blood cells and everything. Oh, I forgot to mention I also had my hemoglobin checked with the breathing stuff, and that was alright. It was a bit lower than what it should be, but other than that it was not too bad. And the hemoglobin, if you didn't know, is the cells in your body that carry the oxygen around. But yeah, anyway, back to the youth centre. What was I saying? Yes, there's like a low point somewhere, so I could be like, well, I will be more susceptible to like infections and catching viruses and stuff like that. And then also during that period, if I want to just lay in bed because I feel like crap, I can do that. Otherwise, she was saying that it's good to just keep some sort of like movement and activity that increases your heart rate to make sure that you're still keeping up with your fitness levels and things. So today I had to wear a heart monitor thing, just something that went around my waist. And we did a few little exercise so that she could get like a baseline of where my heart rate is at. And then we did a few other different exercises that I could do daily just to keep up like fitness. And she was saying that like the fitness and stuff that you should do during chemo, it's not to do with like losing weight or becoming more fit and healthy and whatever. It's just to maintain this level of like energy and active lifestyle so that you don't end up in this major fatigue state where you do nothing, because then that won't be very good. And then after that I ended up going back to the youth centre, and I took a little video of the environment in there, so it's very lovely. And I spoke to the youth worker that basically does all the outside of hospital stuff. We were talking about study a couple of days ago, and I was telling him that like I spoke to my unit coordinator and she was saying that like I've got enough credits to graduate right now with just a generic Bachelor of Arts, which is very nice because now it's nice to know that the last 7 years haven't gone to complete waste, and I now have something to show for it. And then it's nice. I was thinking like it'd be nice to like start fresh after cancer, I suppose. And then I ended up speaking to the other youth worker, so she's more of like the nurse, well, she is a nurse. And I went in with like a list of questions that I'd been pondering. I also told her that like my mum's mum had leukemia, so she'll pass that on to the team. And then in the last couple of days, I feel like my shortness of breath has been a little bit worse than normal. And I was asking if there's any chance that like the tumour in my chest could have grown, and there is possibility that it could have grown, but even if it did, it wouldn't change the course of the chemo and the treatment and whatever. I also have my complete diagnosis now, so it's stage 2 Hodgkin lymphoma nodular sclerosis, which is nice to have like a a full thing of it. We also spoke about, one of my questions were about bodily fluid. So for about a week or up to a week after I have chemo, any bodily fluid could still contain the chemo drugs. So I've got to be cautious in terms of like using the toilet. I need to make sure I close the lid and double flush, and have cleaning wipes and stuff ready on hand. If I throw up, I've got to make sure I clean it up nicely, and if I throw up on my clothes or any other bodily fluids end up on clothes or bed sheets or towels or anything like that, I need to wash everything separate to the rest of the clothing. So that's like that. We spoke about Picc lines and ports. So ideally I think I would have preferred to have a port, which is a little device that gets inserted into your chest, but they generally don't do ports there unless you're booked in or you're scheduled to have chemo for like a long time, so like up to a year, which I suppose like that's fair enough. And then we spoke about the Picc Line. So basically it's almost like a very long cannula, so it goes into the arm somewhere over here, and then the little plastic part goes up this way and then near your heart, into your heart, I don't know, it goes up one of the main, I don't know what it is, the main thing into your heart, and then that's how you'll basically get your chemo. Or if I don't want the Picc Line, then basically I just get an IV every time I go in, which I'm a little bit nervous about because just being stabbed with needles, you know, quite frequently, it can damage your veins, and sometimes they can collapse, and there's just some drama. I don't know how it's going to go, so I'm thinking I might do my first treatment just with the IV and see how I go, and then maybe I might choose to get the Picc Line. I don't know. Anyway, I then stayed for I think like half an hour to 45 minutes doing some of the puzzle that they have on the table. So I ended up completing the border and took a photo of it. So hopefully there's some more of it done by the time I get there next week. Speaking of, I've got to go get my pre-chemo blood test on the Wednesday, and then first chemo is scheduled for Thursday. So that's it for now. Bit of a busy day, but things are progressing. So as you can see, my hair is now green. I'm very happy with it. It's darker than I thought it was going to be. Well, darker than I wanted it to be, but coming from the red hair that I had beforehand, this is the best the hairdressers could do, but it is green. So that was a process. I was there from 9:30 and I didn't leave till I think 2:30 or 3 o'clock, so it was a very long day, but I'm just so happy. I'm a little bit upset that I have a big potential of losing it. And since then I have uploaded my first video to YouTube and spread it on my Facebook and Snapchat, and people have viewed it and have sent me lots of lovely messages and kind words. And I've also created a fundraising page that people can donate to Lymphoma Australia to support cancer patients like myself. So it's going well. We've raised $700 so far and it's going well. I think that's it. And I also think that this will be the last video, and the next video you see will be all about chemo. So see you in the next one. Bye.